Hi everyone, welcome to our second episode of Skincare Talks. Today we're going to be discussing our very own range called MD Cosmeceuticals, which was created by founder, dermatologist Dr. Mathobela. Hi doctor and welcome back.
Thank you, Stephanie.
So doctor's going to be chatting with us about what the MD products do, what it was designed for, who it was designed for, and the vision behind it. So Doc, if we have a look at our beautiful product range here, what can you tell us about it? Why did you create the range?
Right, so when I started in private practice, I was obviously exposed to a lot of products that I found very beneficial for my patients. The only issue is for most of my patients, most of them could not afford some of the products that I had in my rooms that we were offering to them. And I wanted now to come up with a product that will still be a very good product, so highly rated, but very affordable as well. So I then came in contact with a pharmacist who was willing to help me to come up with a line that will still be, up there with the best lines, but very affordable for our patients, because it is obviously going to be created here in South Africa, so we don't have to be paying like the import rates and everything. So it was mainly to have our patients exposed to very good cosmeceuticals, not just cosmetics. As we know, cosmeceuticals are cosmetics that also do a little bit of treating, but at an affordable cost. So that was the main reason why I decided to come up with the range.
That's lovely. Okay. Now, if you were to compare this to other brands, how does your brand stick out the most?
So the good thing about us is that we have a whole lot of other brands that are in the rooms here. So, and we also have patients that have used the other brands and have used our patients. So those patients get to give us feedback, and most of the patients love our range. So some of them actually do downgrade from their much more expensive range, moving down to our, and we've seen results because it's the patients that we recommend the products here, and we get to see them back for the follow-ups. We get feedback from them, we see on their skins what the range is doing on their skin. So it is actually up there with some of the best ranges that we have in the rooms, and that makes us very happy.
That's amazing. And what skin types is it made for? Is it made for someone specifically that has, pigmentation problem, for example, or acne problem, or can anyone use it?
So on this range as it is now, we have a few that products that can be used by almost anyone. So our sunscreen can be used by anyone, our vitamin C's can be used by anyone, and the sunscreens as well can be used by all the skin types. But we also have a range for pigmentation, but that range also is suitable for even a sensitive skin person. The good thing about it as well is that it's available in the rooms. It's also available online. Obviously, in the rooms, I get to see the patients. I know who to recommend what to. Online, they get to speak to you, and you get to hear about their skin issues, and you can sort of redirect them as to which line they can use. So it is cosmeceuticals, and we can sort of, give it to the right patients, give the right range to the right patients. But it's suitable to be used by almost anyone.
Okay. Now, if we were to go through these products, would you be able to kind of take us through what each one sort of does? So let's start from this side, the hydrating and soothing Hylu serum.
So yes, so one thing about my range specifically, except for the serums, is that there's niacinamide in every one of them. I fell in love with niacinamide when I first started in private practice again, and when I was researching ingredients, and I got to find out that niacinamide actually does a whole lot more in terms of the skin, and can be used to treat a lot of things. So the one thing is most of these products have niacinamide. This is a hyaluronic acid, which obviously hydrates, but it also has niacinamide in it, and niacinamide is known for being able to treat sensitive skin. It's good for acne prone skin, it's good for eczema skins, it's also good for aging. In fact, some of the studies now are showing that niacinamide has an element of DNA repair. So if your skin is sun damaged as well, and you're using a niacinamide serum on it, you do get to repair some of the damage. So it's a very good anti-aging product as well. Niacinamide also helps you to be able to tolerate retinols well. So if you are to apply a hydrating serum at night and you follow it up with your retinol, you have a very high chance of being able to tolerate it. So it hydrates, but also anti-aging benefits as well. Soothes, suitable for sensitive and normal skins.
That's amazing. It's a full 3-in-1 serum,
Yes.
actually.
Yeah.
Okay, and then I see we have 2 vitamin C. So we have one with glutathione and we have one that's just a normal vitamin C. How do they differentiate?
So this vitamin C, obviously it's a 10% vitamin C, but it also has vitamin E in it. So when you're looking at your vitamin C serums, you want to actually have multiple antioxidant in it for your antioxidant serum to work nicely. But this particular one is also a little bit oily. The only reason why really was that I decided to come up with the second vitamin C serum is that some of my oily patients, as much as this really does not make you that oily, but people that are already very highly oily, they were complaining that afterwards it still feel they love the product, they love how it's treating their skin, they're becoming bright and everything, but they just feel like they're a little bit too oily in the day. So we decided to come up with a vitamin C that will be in a gel form and just add a little bit of glutathione in it. Glutathione, not only does it brighten your skin, but it's actually a very good antioxidant. So that was the main reason. So some of the patients that have oily skins and they have PIH, so post-inflammatory hyperpigmentation, will benefit from the vitamin C making them brighter, but also the glutathione as well making you brighter. But glutathione is actually a very good antioxidant, so it was just a matter of combining a lot of antioxidant. It also has licorice extract, which also helps in terms of the pigmentation. So if they are more pigmented, then it will be this. The more drier that will want a little bit of hydration, then they will take the oily vitamin C. But they both work well.
Okay. And Melanin Clear, the pretty little purple bottle here, I'm assuming this is for pigmentation. How does it target that specifically?
So it is for pigmentation. The reason why I came up with Melanin Clear as well is that your pigmentation serums that are available, that are good, are actually very expensive. So I also now wanted a very good serum that works for pigmentation. We also have a lot of reviews on Melanin Clear and most patients love what it's doing on their skin. There's a lot of ingredients in here that all target pigmentation. As you would guess, niacinamide is already in there. There's also tranexamic acid, which is gaining a lot of momentum in the literature spaces on how it works well for pigmentation. But we have kojic acid, so there are a lot of ingredients in it that targets pigmentation without really irritating your skin. So it doesn't have a lot of irritants, but it has a lot of good ingredients that work nicely for your skin. So there's alpha-arbutin as well. It does have a little bit of a vitamin C, but you'll get most of your vitamin C from the vitamin C serums. But yes, there's a lot in peptides also that work nicely for pigmentation. It's actually a very nice serum for pigmentation.
So seeing as though it doesn't cause irritation, it's good for also sensitive skin.
So though people with sensitive skins will just make them, because it has a lot of ingredients in it, will just make them introduce it slowly, but there's a very high chance of them being able to tolerate it.
Okay. Now let's move over to our exfoliating toner. This sounds exciting.
It is very exciting. So generally speaking, I'm not the one that gets to recommend toning quite a lot, but we do have patients that have been on retinol for a very long time, and they feel they've reached a point where they feel like their retinol is no longer doing much. They're tolerating it at high dosages of retinol, and they feel like they're no longer really getting, they're not going to the extra level of having their skin doing the things and popping. So those people who can tolerate retinol very well and they've been on it for a long time, then they introduce an exfoliating toner, which just, it has glycolic acid, it has lactic acid. It's not highly irritating, but it just takes your skin to a higher level. It also has niacinamide, so also good for pigmentation. So they will introduce it into their routine at night, starting by 3 times a week. Sensitive skin people can also use it, but they will just have to go slower. And they will obviously not use it on the same day when they are using their retinols. So they will alternate between the retinol and exfoliating. But people that are tolerating retinol well, they don't use it every day, but they can definitely use it under their retinol if they can tolerate it. But yes, very nice. I've used it as well, by the way, and for my skin it's also doing wonders.
That's good. Okay, then we have our retinol. So
yes.
Speaking of retinol, so we could possibly combine this retinol using this together as well.
Yes.
Is our retinol also suitable for a more sensitive skin?
Our retinol is definitely suited for a more sensitive skin. So there's also a child in here which has been making quite a lot of noise over the socials. So it is a much more sensitive skin, related retinol, or yeah. So it has this retinol that is in here can compete with your tretinoin without irritating your skin. So we're expecting quite a lot. There was a study that actually that they looked at it, and they found that this retinol that we have used give you more or less the same effect as the tretinoin, so your differing your adapalines without irritating your skin. So it is a good retinol. Niacinamide also. I am a niacinamide girl. And book a child. So it's quite good. So this is what also, if we have somebody that we ultimately want to have on things like epidural or different, but we want to introduce them into retinol and just make them get used to retinol, this is something that we can start with. And obviously if it works well and it's treating their acne, they can stay on it. But if we feel they need more, they can start here and we build them up slowly to a prescription retinol. Yeah.
And could you use this possibly every day, let's say for someone that's not sensitive? So introduce it straightforward every day into your nighttime routine.
I wouldn't say every day, because sometimes people think their skins are tough like that and they can just start with using a product every day. So for those people who say their skins are not that sensitive, I would still say maybe yes, you accelerate it quicker, but maybe every 2 weeks, unlike every month. For sensitive skin, I always say for a month they're on 3 times a week. So somebody who says their skin is not sensitive, I'll say every 2 weeks. So start with 3 times a week for 2 weeks. You go to alternative nights for 2 weeks, and then ultimately you use it every night. Sensitive skins, sometimes even for sensitive skin, we say twice a week for a month, and 3 times a week for a month, alternative for a night, and ultimately maybe every night. Sometimes sensitive skin people can't even get to every night, so they stay on alternative for 3 times a week. But a little bit of retinol is better than no retinol at all.
That's true. You still want a little bit of benefits. Yeah. Okay, so moving on to our moisture rich cream. This is a nice cream. I personally use it. It feels amazing on your skin. So what can you tell us about this cream?
So the reason behind this particular cream was mainly for my retinol patients. Because patients that use retinol, especially the prescription retinols, they can dry you up. So they are flaky, they don't tolerate the retinols very well because their skin is sensitized and dry and flaky. So you want to use a moisturizer that has ceramides, you want to use moisturizer that has niacinamide. Niacinamide actually helps also your skin to build more ceramides. It helps to improve your barrier function. So you want to use a moisturizer that supports your skin to be able to tolerate the retinol. So that was the reason behind this. But we've got to find out, as patients were using it, that it actually does much more. So even for your sensitized eczema skin, it works well. Most patients love it, but yes, the main aim behind it was to be used together with the retinols. But other people are just using as their daily moisturizer now. For me personally, I was even calling it a night cream. So now I'm no longer calling it a night cream anymore, because most people love to use it in general.
I use it day and night, and I mean it doesn't make me oily at all, so it's quite good. Okay, and then our 2 sunscreens. So we have a tinted sunscreen and we have an invisible sunscreen.
And just to say that this is not the finalized packaging. The new packaging is coming out very soon. But also the reason behind the sunscreen was that patients were complaining that there isn't an affordable sunscreen out there that is good, obviously a high SPF, good and affordable, and especially for darker skins, that it does not leave you with that whitish cast. So I also spoke to my pharmacist and we came up with these 2 sunscreen, the tinted one for those ones that are struggling with pigmentation, and the non-tinted ones for everyday use. But very good sunscreen, high SPF with a lot of antioxidants, because you want your antioxidants in your sunscreen to help you with the pigmentation, but also to help you out with pollution, as I said. And they absorb well, they apply well, so a win-win overall.
Okay, so now that we've heard about this amazing range, I'm sure you guys are wondering if there's going to be more products that's going to be added to your range very soon. So do you think that you could maybe give us a hint as to know whether anything is coming or not?
Yes, definitely there'll be a lot more coming. So it is a range that I would love to expand on. So I am working on a pigmentation moisturizer. We're working on a hair growth serum. Obviously we need a cleanser, which will be coming out soon as well. There's a whole lot more coming. They come in slowly, but they do come ultimately.
That sounds great. Okay, so there you have it from Dr. Mathobela. For those MD Cosmeceutical fans, there will be a lot more products coming out, so watch this space for more videos on our products and what they can do for your skin. Thank you.